Hello, this is Fadi Al-Fayoumi, and this is my final presentation for the MBA program at Washington State University under the title of the Vein Clinic Service at the Heart and Vascular Clinic. Our product description, it's a vein clinic service. We are introducing a new service at an already existing heart and vascular clinic by introducing the diagnosis and treatment of vein disease as a new service. We're going to start with the medical introduction. Normally, the function of the veins is to drain the blood back to the heart. It's being done by the effect of valves, the function of which is to allow the blood to go in one direction but not the other. In the event those valves don't function very well for various reasons like genetic reasons, pregnancy, medications, or trauma, the vein can become distended and swollen like that. Clinically, this can appear as varicose veins or spider veins. The spider veins are the small ones and the varicose veins are the big bulgy ones. Well, the varicose veins can cause swelling in the legs and the arms in the event they are available in the arms, and eventually that can cause inflammation or dermatitis as it's called in medicine. This eventually can lead to ulceration of the skin superimposed by infection, and the results can be disastrous like amputation, for example. And therefore vein disease can be very important because it cannot only be cosmetic, but it can cause to clinical disasters. The treatment in the past used to be surgical intervention, where the surgeon will introduce a big, long scar tissue across the thigh and take the varicose vein out. The treatment was expensive, the treatment was ineffective 40 to 50% of the time, and the treatment will leave a big scar tissue behind. Not exactly what you're looking at. A service that should be providing a good cosmetic appearance at the end of the operation. With the new technology, laser ablation of varicose veins become available, where rather than making a scar tissue across the thigh, a laser will be introduced through a sheath inside the lumen of the vein, and by applying heat inside the vein wall, the vein walls will collapse upon each other, causing a closure of the vein. Eventually that will cause the blood not to be inside the lumen of the vein, and eventually the varicose vein will go away, and so is the clinical consequences of this. This can be complemented also by doing something called phlebectomy. Phlebectomy is removal of the varicose veins under micro incisions. If there are small varicose veins right under the skin, then the surgeon can make a micro incision and take those varicose veins out in the clinic without need for major anesthesia. You can do this under local analgesia. And you can also finish the therapy by doing something called sclerotherapy, where a local agent can be injected into the very small veins right under the skin, and that can cause the disappearance of these veins completely. Simply, rather than doing surgery, you can do this endovascular intervention, where the patient can show up to the clinic with bulgy veins, swelling in their legs, small spider veins, along with veins under the skin. And between laser ablation, phlebectomy, and local injection with a sclerotherapeutic agent, you can start with something like this and end with something like that, with a therapy that's effective more than 90% of the time without surgery and at a much lower cost than what was in the past. So, with the vein clinic service we're introducing, it's going to be what we call it a comprehensive approach, where the patient will show up to the clinic and the very well-trained physician in the field of vein disease will start a history and a physical exam process. Eventually, that will be complemented by doing an ultrasound to diagnose which vein is responsible for this particular patient problem, and then eventually decide which one therapy or combination of therapy between laser ablation, phlebectomy, or sclerotherapy will be the best option for the patient. Keep in mind, treatment of vein disease is very complicated. If we look at the vein clinics across the nation, most of them are not operating under the comprehensive approach. Most of them are using a SPA model, where they're using only sclerotherapy or local touch of laser therapy under the skin. And with that, you can have an immediate nice results where the patient will show up, they will have varicose veins, you will inject them, or you will locally remove them without essentially doing an ultrasound or take the patient history without diagnosing which vein is responsible for the problem. You can end with nice results immediately. The problem with this approach that the most are using nowadays is that recurrence will be very high because you've never fixed the actual problem. People will come back, and therefore the actual service was never well provided, and customer satisfaction is not there. If you want to get adequate results, then you have to treat the actual underlying problem. That by itself, knowing what is the actual underlying problem in every single patient, require extensive training in varicose veins. And most physicians who are operating vein clinics are operating that for the sake of cosmetic results rather than for the legitimate approach. Well, with our company, Dr. Fadi Al Fayoumi has been trained very well in the field of vein disease with the best in the nation, and therefore the comprehensive approach will be used rather than the cosmetic appearance approach immediately. Beyond all of that, we are actually operating that in an area with a high demand in the city of Brownsville, Texas. And when we talk about the industry analysis, the United States healthcare market remains to be one of the most attractive markets on the globe. Reason beyond that is that we still operate under the fee-for-service model. More volume, more revenue, more overhead, more business planning. We don't have a socialized medicine at that point. More important, with the new pressure of the healthcare bills, there is more pressure from the insurance companies to treat different medical pathologies and medical conditions as an outpatient rather than inpatient because of the cost issue associated with being an inpatient. We'll take an example in our era. If you look at somebody with varicose veins and he's taking a surgical intervention in the hospital, the cost will vary between $15,000 and $40,000. While if you apply a complicated outpatient setting with 3 to 5 sessions of therapy, you're talking about $5,000 to $7,000. If you look at the statistics of 2012, more than 3.8 million vascular procedures were done in the United States with a revenue of about $1.7 billion, which is expected to grow at a rate of 2 to 4% annually. And therefore, the field of endovascular intervention is considered a very attractive field in the era of medicine nowadays. When we look at the customer analysis, the clinic will operate and the vein clinic service will operate at the Heart and Vascular Clinic, which is an already existing clinic in the city of Brownsville, Texas, the population of which is about 250,000 people. That does not include the people from Matamoros, Mexico, who cross the borders on a daily basis to seek medical attention in the United States. And we're expecting 10 to 15% of our patient population to be cash payers from Mexico. But when we talk about the competition analysis and we look at the bigger picture of that, then we can understand why we can actually include the city of Harlingen and McAllen, Texas as a potential customer analysis area, and that will increase our population to about 750,000 people. So when we look at the competition analysis, if we Google South Texas for vein clinics, we will find 3 vein clinics within 50-mile radius of Brownsville, Texas. And they exist as 1 vein clinic in Brownsville, 1 vein clinic in Harlingen, Texas, and 1 vein clinic in McAllen, Texas. But again, those clinics are operating under the SPA principle, where the people will go there, maybe a little bit of a phlebectomy, where they can take small micro incisions and the vein can come out, or maybe a sclerotherapy, and sometimes not even done by the doctor. If we look at the comprehensive approach, where there is a doctor who is very well trained in the field of vein disease by the experts in the nation, along with using Doppler sonography to define which vein is responsible for the problem, along with pinpointing what mode of therapy will be the best for this particular patient, which can be different than his sister, different than his dad, and different than any other patient. Now we're using this comprehensive approach without saying there is only one treatment that fits all or one technology for all. To ensure adequate results, then we are literally talking about no competition when it comes to this comprehensive approach. The barrier to the entry to the market will be mainly the public education about the difference between our comprehensive approach and the expenses that's going to come with starting this comprehensive approach by buying all these materials, the equipments, and the laser catheters. As far as our marketing plan, the tactics we're going to use are many, but mainly we are going to be dependent on the primary care doctor's referral to the clinic. So the physician will give seminars and will go to the primary care doctor's offices and discuss with them the comprehensive approach compared to the others and promise more than 90% success rate with very low recurrence rate in most of the patients because of that comprehensive approach. In addition to that, the word of mouth that comes out of the patient based on their results and based on their outcomes will be one of our main marketing planning. We're also using a partnership with the hospital when it comes to operating the vein service at the Heart and Vascular Clinic. Not only the hospital will help us with the purchase of the equipment so that we can rent it from them, but they will also provide marketing plans by using a software which will selectively send mail cards to the people who has been seeking attention for treatment of vein disease. As far as the operation and technology plan, when it comes to the technology plan, we are implementing the electronic medical records with accurate patient data entry to the system, along with taking pictures before and after to ensure that the patients are satisfied with their results, especially when we talk about treatment of varicose veins in the back of the legs when the people do not appreciate how much of a bad disease they had before. As far as the inventory control, we're going to buy enough inventory for the first 10 patients when it comes to gowns, gauzes, laser catheters, phlebectomy equipment, and sclerotherapeutic agents. And after that, it's going to be based on appointment, and that will help us to control our inventory and so our expenses. The quality control will be based on guidelines issued by Center of Excellence in the nation for the treatment of vein disease. And with that, we're going to use the Mayo Clinic and the Cleveland Clinic statements of excellence and quality control when it comes to outcome expectations for management, diagnosis, and treatment of vein conditions and vein disease. As far as the labor requirements, we're going to hire a nurse immediately to help the doctor with the process of education for the patient, help the doctor during the procedures as the outpatients, and explain to the patients the proper expectations for the outcomes and answer their questions before and after the procedure in person and on the phone if they require this also. The organization will be the Heart and Vascular Clinic, the president of which will be myself, Dr. Fadi Al-Fayoumi. We have our cardiology service with the nursing staff. We have ancillary services which include an echocardiography machine, which is an ultrasound of the heart, vascular ultrasound machine, which is going to be used to diagnose the vein conditions, nuclear cardiology equipments along with their technicians. And when it comes to the vein service, we will have the same staff, but we're also adding an extra nurse who's going to be hired immediately to assist the medical assistants in the process of starting the vein disease service at the Heart and Vascular Clinic. The social responsibility of the clinic, well, it's a medical clinic, so by itself, providing the service to the public, that by itself is a social responsibility. We're going to take that beyond providing the service. The vein clinic at the Heart and Vascular Clinic will provide also public education for free. Well, the doctor will go, and through a sponsorship with the hospital, they will have dinner with the doctor, and the public will be available for all sorts of questions they have to answer them and educate about vein disease, vein complications, and the difference between who needs a cosmetic service versus who needs an actual treatment and preventive treatment for their condition. When it comes to the financials of the vein service, the procedures will vary in price. For example, the consultation with the doctor will be provided for free for the patient. That's going to be part of the comprehensive approach. The ultrasound diagnosis of the vein condition will cost about $150 to $200 per patient. The phlebectomy is about $500. The sclerotherapy will be $350, and the laser ablation reimbursement by most insurance companies will run between $1,200 and $1,500. So the vein clinic will start operating at the Heart and Vascular Clinic as one half day a weekend, and then will increase the appointments based on demand. We're going to try to control the inventory based on that. And we're expecting, based on these numbers and based on this reimbursement, with an average growth of about 7% annually, based on these numbers, 57,000 revenue in the first year, and beyond that it goes annual about 7 to 8%. Those are actually very conservative numbers. The reality is we're expecting that to go way beyond that, but to be conservative, we're looking at 7% annual growth when it comes to this area. So this was the end of my presentation. I'd like to thank you very much. This has been a pleasure, and I'm very thankful for all the advisors throughout my MBA program. Thank you.